the national AIDS strategy effort going to wind up as a document that sits on a shelf that looks nice and doesn't get anything done? Or are we going to use this opportunity to really make some bold moves in terms of reforming our approach and making sure that it is strategic and really accomplishes better outcomes? So I think the first thing we have to ask for is that federal agencies, with the leadership of the president, really show us how they're working collaboratively to bring HIV incidents down, increase care access, and reduce racial disparities in the epidemic. We need to see concrete evidence about how we're changing the way business is done in response to HIV. I think that we also, because we're going to be focusing more on outcomes here, I think it's also fair to say that it's time to increase appropriations for prevention, which gets very short shrift in our domestic response to HIV and which has been flat funded for many, many years. There's just no excuse for it. We need to put more resources behind prevention. President Obama has said that a national AIDS strategy is his top HIV/AIDS priority in the United States, and we're very grateful for his leadership on the issue. Now what we need is for the president to speak out publicly and say to the agency heads in his government that he wants to see them working collaboratively, thinking out of the box, and reforming our response so that it's much more outcomes oriented and accountable for specific results. I think it's really important that we remember that there's many different issues that we need to be talking about. One, of course, is appropriations for critical programs like the Ryan White Care program and for prevention at the Centers for Disease Control. But it's also time to put AIDS research back on the advocacy agenda. You know, at the beginning, that was the bread and butter of the advocacy work, was research. And it's time now for lawmakers and the president and people at NIH to be hearing again how critical it is that we advance research on things like a cure, a vaccine, a microbicide, and better treatments that are cheaper and easier to take. All those things are really critical, and we're never going to end the epidemic until we do more investment in AIDS research, in addition to doing more to getting services out to people. amfAR has really increased our investment in public policy work in Washington over the last few months, and we've done that because we really see a lot of critical opportunities in terms of AIDS advocacy here in Washington. That includes national AIDS strategy, it includes appropriations for our global efforts, and the best opportunity we've had in a decade to end the federal ban on syringe exchange. Now is really the time to be mobilizing around syringe exchange. We've seen real leadership from Chairman Obey of the House Appropriations Committee in terms of getting rid of this, the ban on federal funding. It's time that the Senate and the President hear directly from us and continually and ceaselessly about the importance of getting rid of this ban. If we can get rid of the ban on federal funds for needle exchange, we can really advance the public health response here. We know that syringe exchange works to bring down HIV incidence, and we also know that syringe exchange programs around the country are scraping for money and can't meet the need in terms of providing clean syringes, but also all the prevention and care work that they provide to people. They're not keeping up with the need because they don't have the resources. If we could open up federal funds for those kinds of life-saving services, it would do so much in this response.